Thanks, Brandis. Earlier in the show, we heard about the official COVID figures from Lollapalooza. The city's top doc said it was not the super spreader event some had feared it would be. But how accurate is that? And what is the Delta variant risk to children now that the first day of school is almost upon us? Joining us to help answer these questions and much more is Dr. Susan Bleasdale, the Medical Director of Infection Prevention and Control at UI Health. Dr. Bleasdale, welcome back to Chicago tonight.
Thanks for having me, Paris.
It's good to see you as always. The state is averaging about 3,000 new cases per day over the last 7 days. Test positivity about 5.8%. Are there models that tell us whether this is on the rise or is plateauing right now?
It looks like this is on the rise. This is similar to what's been seen in some other states when the Delta variant has become a predominant strain, that the numbers start to increase and increase rather rapidly just because of the ease in the way that it can be transmitted.
So we can expect to see those cases continue to go up for the time being. And Dr. Arwady, meanwhile, suggests that only 200 or so cases were reported out of hundreds and hundreds of thousands of concert goers at Lollapalooza. Do you buy that as an accurate number?
Well, I think that it's a sample, right? Because I don't know that we have all the information from that event. We are 2 weeks out. We're seeing some increase in the number of cases. Those that through contact tracing self-identified as being at the Lollapalooza event are showing that there's a small number relative to how many that were there. There's several that are outside the city of Chicago that it's not clear if the city has all of that contact tracing data. So the numbers of cases that they identified, some were within Chicago residents and some weren't. But again, it's not clear that they have all of the information. There may be other cases that are not really captured in their data. So it may be larger, but I think overall, probably not to the highest scale that we had been concerned. I think that the testing and the requirement for vaccination was a good mitigation strategy, but I think there's probably still some more cases out there that haven't been identified.
And what city officials say again is that 90% of folks that attended were vaccinated through their own measurements here. Let's talk about the risk of breakthrough cases. The city says 99.7% of new cases are among the unvaccinated, but I think we've all heard of a number of breakthrough cases anecdotally. Is there any evidence to suggest the breakthrough rate might be higher than is being reported?
It's probably higher at this point that's being reported. It takes a little while for that data really to get to the reporting circumstances. And I think all of us have been seeing these cases that are following them, that there are some breakthrough cases in people that are vaccinated. And there's a couple of issues around that. Some people may not know that they can be infected even though they're vaccinated. So it's really important that if anyone has any symptoms that they get tested for COVID even though they've been vaccinated. Really important too that they know that they can still transmit it even though they're vaccinated. Their risk is lower, but it's still present and it's likely they're going to have a mild disease. Some people may not get tested and may not know that it's attributed to that event. But I think we're really going to start to see more cases. We are starting to see some more cases identified in those that are vaccinated. Again, mild cases, but it's really important for people to make wise choices about when they unmask, even for those that are vaccinated. I think the awareness that you can still get it is news to many people that are vaccinated.
And the data seems to be more conclusive that in breakthrough cases, the symptoms overwhelmingly tend to be milder than in unvaccinated folks. Let's talk about the FDA recommending a third booster shot in folks that are immunocompromised. Do you believe that will be very helpful to that population?
I think it will be helpful to that population. I think the confusing messaging right now is you're hearing about breakthrough cases and boosters at the same time. But like you mentioned, the people that are vaccinated that are getting these breakthrough cases are really still protected against hospitalization and death. And that's where those numbers are, where still 98% of our hospitalizations and deaths are in the unvaccinated. So the vaccine is really showing that it's still protecting people at this point with the increased number of cases. But we do know, and we've had data all along, that those that are very vulnerable, their immune system is not strong. It's people that have had either an organ transplant or a blood transplant, that their immune system just can't mount the same response to the vaccine. So they need a booster, and it will be likely approved shortly for these particular groups. And then it's really important for those that live around these vulnerable people that they get vaccinated to help to kind of cocoon and protect them as well.
All right, important information there. Another group of concerned citizens or concerned population, parents of kids under 12, especially with kids going back to class now. What does the data say about how at-risk children are to getting significantly ill from the Delta variant?
Well, we're seeing increased cases overall, and I think that then you're seeing some small numbers increase in hospitalizations nationally because of the Delta variant, and it's hard to tell how much of that is related to just there's more transmission of cases because the younger population either is not vaccinated or is just starting to have activities where they're being around each other unmasked. So we're seeing a really rapid rate of transmission and then secondarily see some small numbers of cases of increased hospitalizations. But overall, most of the cases in those that are young are not significant in causing hospitalization. We're just seeing a lot of transmission because it is so contagious, this new variant.
And so we only have a few seconds left, Dr. Bleasdale, but do you think the statewide school mask mandate is sufficient to protect kids and their parents and teachers from spreading the virus, or do you recommend more mitigations?
I think that's a critical point to help to protect, to be able to get back to in-person education, because we know masks work. They're really one of the most effective ways in preventing that transmission. So masking works. We know that even though you're vaccinated, for those that are old enough, that's an additional measure of protection for you. But for those under 12 and for everyone that's going back to in-person instruction, those masks are really helpful to prevent transmission.
All right, Dr. Susan Bleasdale, thank you so much for filling us in on all of this latest COVID information. Appreciate it.
Thank you.